course in moving things forward for the benefit of those impacted by disadvantaged situations. Let's welcome the President and CEO of Ronald McDonald, New York, Dr. Ruth Browne. And thank you, Dr. Browne, for gracing us with your presence.
Thank you so much, Beverly. And I haven't seen you in a long time, but I'm delighted to see you on Zoom this morning. I just want to say thank you to this newly forming Rotary Club for inviting me to speak on health equity today. It's really a privilege. I know how dedicated you all are to international service and cultural immersion. And quite frankly, I saw so many parallels between the work that I do at Ronald McDonald House, New York, and the Rotary Club. So just to take you there, I mean, I think we both work as part of an international organization that's supporting local chapters responding to local needs with a focus on partnership. And in addition to our work that we do with hospital partners, we are also represented by local businesses and corporations who volunteer at the Ronald McDonald House and play a variety of roles, from serving meals to acting as thought partners on strategic ventures. So I was really delighted to learn of the club's initial focus on Jamaica. Jamaica is very special to me. My own father emigrated to the United States from Guyana. So I am a Caribbean girl. And Jamaica holds a particular significance for me professionally and personally, and I'll tell you why. I had the opportunity to study at University of the West Indies in Jamaica as an undergraduate when I was at Princeton University. And it was there for all of my previous schooling that I found myself surrounded by students and professors who actually looked like me. And that was the first time in my entire academic tenure. So it was a really wonderful experience. And then later in graduate school at University of Michigan, I spent the summer working for the Ministry of Health in the parish of Portland, Jamaica. And so I traveled around the countryside with public health nurses and really got to see firsthand how people living in semi-rural communities were accessing healthcare. And for me, a graduation present came in the form of a newly developing program, a 4-month certificate program that was situated at the University of the West Indies in Jamaica. And I was hired to be the first on-campus coordinator for this new training program in public health. And that's where I met real public health workers, people working in the field as sanitarians and inspectors, people who were, managing slaughterhouses, et cetera. That's what you call real public health work. And that program still exists today. It's a master's program in public health at the university, but it initially started with University of Pittsburgh, USAID, and the American Public Health Association. So my roots in Jamaica were early and formative. And service learning opportunities like those galvanized my own desire to work in the field of public health. It's a field that promised to combine meaningful work with travel, and I know that is core to your mission. Public health really would allow me to experience different cultures and at the same time learn more about my own. So I'm going to take us right into the work of the Ronald McDonald House, and you can go to the next slide. When you think about a family that has to travel to New York City with their seriously ill child, they're coming for life-saving treatment. Many of these families have been a lot of other places and it hasn't worked. So they come to Ronald McDonald House, New York, because it offers a safe, clean, and supportive place to stay that's close to the major hospitals with a seamless circle of support tailored to each family. And the house has private bedrooms and family rooms and kitchens. We have 5 kitchens and a library and a play spaces, a computer room, laundry facilities, tutoring services for those children who are well enough, who are patients, but also for their siblings who are traveling with them. A wellness center for caregivers, and transportation services, all designed to keep families close to each other while they concentrate on what is the most important thing, which is their child's health. And Ronald McDonald House New York has been expanding its programming beyond the services we offer in the 4 walls of the house to include family rooms and remote services that are located in public hospitals and safety net hospitals throughout the 5 boroughs of New York City. So I will tell you, my journey was to come to Ronald McDonald House in 2016. I was the first African-American president and CEO of Ronald McDonald House New York. And for 12 years prior to coming to this organization, I was the founding chief executive officer of the Arthur Ashe Institute for Urban Health. And many of you may remember Arthur Ashe, the legendary tennis champion and humanitarian, first African-American man to win Wimbledon and the US Open. So in 1992, he lent his name and announced the establishment of the Institute for Urban Health in Brooklyn. It was intended to be a national organization that would develop model programs in Brooklyn that could be replicated. But it was his health and educational legacy. The goal was to promote health equity through community health empowerment and engagement, and strategic partnerships and innovative community-based education and preparation of a more diverse healthcare workforce. So I spent a lot of time developing what was an idea on paper that into a model community academic government partnership that still exists today and provides much needed services to urban underserved communities. But when I arrived at Ronald McDonald House, I arrived in the middle of a $26 million renovation of our house. There were construction workers everywhere, and my duties ran from steering a large board through a strategic planning process during a pandemic to being sure everyone had enough soap and towels. And I will tell you now that our strategic plan, growth plan, really helped to us to migrate from being a traditional children's charity that was pretty much operating like a hotel to becoming an incredibly important part of the healthcare continuum in New York, improving health outcomes and reducing costs for families we serve and for our hospital partners. So family-centered care is core to what we do at Ronald McDonald House, assuring the health and well-being of children and their families while honoring the strengths and the cultures and the expertise that they bring to the relationship. And so I know your club is going from local to international focus. Our strategic direction is expanding in the other direction. We have served an international base for 35 years and will continue to do so. I would say 40% of the families who come to Ronald McDonald House come from all over the world. But our current direction also calls for an expanded focus on safety net hospitals in the 5 boroughs of New York, serving a new population of Medicaid eligible, underserved patients seeking treatment in under-resourced institutions. So we can move on to the next slide. I always like to center the work of Ronald McDonald House by giving it a human face. And I'm going to just tell you a little bit about what happens in the house, but I'm going to put a human face on the work and tell you about Marcus. So I met Marcus literally the first week I was at the Ronald McDonald House. And Marcus is a little boy from St. Vincent. He was traveling to Ronald McDonald House with his father. He had cancer. And my first week at Ronald McDonald House was incredible. I met Robert De Niro on my second day. I think my third day, I met Allison Felix, the Olympic hurdler, and Marcus. And so Allison Felix had come to the house because she had had a cousin who'd stayed at a Ronald McDonald House, and she was really giving her time to spend time with our families. And Allison had just come from winning the Olympic gold. So she wore her medal, and she met Marcus, and she gave her medal to Marcus to wear while she was at the house. He was running around, spinning like a top, couldn't have been more excited, full of energy. And it was a wonderful day for our children and families with Allison Felix. But I didn't see Marcus for probably several, maybe 3 weeks. And one day I walked into her beautiful full living room space, and there was Marcus sitting on the couch. And the great thing about working at Ronald McDonald House is that our offices are in the house with children and families. So I know what difference my day makes when I walk out of my office and see children and families in the house. So I hadn't seen Marcus. I saw him and I said, "Hey, Marcus, I haven't seen you for a while. How are you?" And he said, "Oh, I'm great. I was in the hospital, but I'm doing much better." And he was so happy to be back at the Ronald McDonald House. And that's really what we do. We try to create memories for families, memories of them together. And it is a house of joy. It's often thought of as a hospice for children. I'm so proud to tell you that 20 years ago, 85% of the kids who came to Ronald McDonald House didn't make it. But 20 years later, 85% of the kids who come to Ronald McDonald House do make it. It is a joyful place to be. Anyway, spent some time talking to Marcus, and then a colleague took me aside and said, "Ruth, Marcus is going to hospice today." Well, I was so shaken. I had no idea, and clearly Marcus didn't either, but what it showed me was how important the journey is regardless of the outcome. Marcus, who had been in the hospital, couldn't wait to get back to Ronald McDonald House, where he was among other kids who were wearing a mask, and this was before COVID, who had a port, who might have, have lost their hair, who were small because of the treatments they were on. And he was full of joy. And that's what we do. So at the house, and now in the city, safety net hospitals, we've created memorable, sane, normal journeys for these families where they can be together and grow resilient under the worst possible circumstances. So next slide. What I want to do is just give you some context. The work that we do is really work that responds to the social drivers of health, which is what these families bring to the experience of having a really sick child and coming to the Ronald McDonald House. They're coming to access healthcare services. Most of them have rare and aggressive forms of disease where the treatments may be offered by a clinical trial that happens to be in New York City, with the one researcher working on that rare and aggressive form of cancer, let's say. But decades of scientific research have revealed that 80% of one's health and well-being and health outcomes are really determined by your income level, your educational attainment, your health behavior, your environment, including transportation systems, workplaces, schools, air quality, access to clean water, and healthful food. And these are the social drivers of health. They're the determinants that mirror the services that we provide at Ronald McDonald House. Next slide. No, thank you. So I'm going to tell you just a little bit about our practice model of care. And when you think about Ronald McDonald House, we are really trying to build the resilience and wellness of families by ensuring positive health outcomes and improving health equity in the long term. And in order to do that, we have to address the emotional needs, of our families. And we do that through both our housing model and psychosocial services. We offer security and stability by offering stable temporary housing to families, as well as transportation and regular meals, 3 meals a day, that we offer to families to create that sense of normalcy and stabilities for these families in crisis. And then also nutritious meals, right? We're trying to offer culturally appropriate and nutritious meals that reduce the cost for these families and the psychosocial burdens on families. But the communal nature of our house is what is really where the value proposition comes in. It's family to family, child to child, caregiver to caregiver support that families get from each other. And then, of course, the financial relief that comes from financial literacy, education, and assistance with medical debt reduction. So the positive impact of Ronald McDonald House New York services on family resilience and wellness really underscores the immediate need to innovate and expand our practice model of care. Next slide. Thank you. So when you think about having a diagnosis of cancer or another illness, another serious medical illness in a child, it really does trigger psychosocial and financial burdens on families, and it disproportionately affects those who already face healthcare disparities. If 400,000 children in the world are diagnosed with cancer, 17,000 in the US. Cancer is the leading cause of death by disease in children in the US, results in nearly 2,000 deaths annually, and significant health inequities. And when we think about Black and Latino children in particular, they have the lowest pediatric cancer survival rates than their white counterparts, and increased rates of long-term chronic conditions like heart disease, but also second cancers. And when you think about the social drivers of health, like poverty and limited education and public insurance and literacy and limited English proficiency, as well as a lack of insurance completely and low literacy and geographic distance from providers, you're talking about things that actually confound the ability to survive a diagnosis of a serious medical illness. So families face a lot of burdens. And what we try to do is really address these exacerbated health disparities by offering the kind of holistic programming that's designed to improve both the physical and environmental health outcomes and provide essential respite for families in crisis. Next slide. So broader context for what we do, right, is the reality that all of us faced with a pandemic. And here you have a quote that I think was found in Harvard Business Review, but it basically said, COVID-19 wasn't an anomaly. It was a magnifying glass, and it exposed inequities that persisted long before the pandemic. Inequities in life expectancies, in birth outcomes, in maternal health, in chronic disease prevalence and outcomes, and much more. And for us, COVID was an accelerator for our work. The existing disparities were really just thrust into public view in COVID and in New York City during the pandemic in ways that we could never have imagined. And so that magnifying glass is real, right? But at the same time, there is, next slide, there is equity reform in health equity. And what we are seeing in post-pandemic America and in New York in particular are reforms that are really addressing these inequities that have always existed. One of those reforms is in New York State through the Medicaid waiver. And what that waiver will do is really begin to underwrite the support for programs that address the social determinants of health, the social drivers of health, in a way that has never been reimbursed before. And so when you think about the services that Ronald McDonald House offers to families, now there is a way to be reimbursed for services that we've previously had to provide with our own philanthropy. So that's a very positive direction for the work that we're doing, particularly as we expand service to a population that is Medicaid eligible in ways that we have not before. And so when you think about our 95-room house, we are operating at full capacity. I'm going to ask for the next slide. Our full capacity means that we're managing a waiting list, and that waiting list is constant. Full occupancy is full occupancy. It means the full footprint of the house is all we have. When we are full, we are trying to see who can move out of the house because they're not in active treatment anymore. In order to be in our house, you have to be in active treatment. But ultimately, the house and the seamless circle of support we are offering, we are now exporting remotely through our programs to go and through the building of family rooms in safety net hospitals. So really expanding our reach. We served in 2021, the first year of execution on our new strategic growth plan, we served about 32% Medicaid families. We are, by 2025, expect to serve 62% Medicaid families. And if you look at the map here, this is where we're going to be growing. I'm going to ask to advance to the next slide. We're growing from the highest poverty areas I'm sorry, I think we go back to that slide. We are moving from 2021 and moving to 2025 to the highest concentration of poverty areas. And that's where we are locating our programs. Next slide. Yes, that's what I was showing you, the footprint from 2021 to 25. So when you think about our response, right, and the deep need in the local community that's been exposed by the community, we're now focusing on expanding that outreach beyond the house's walls into the community and are moving now in our third year of this strategic growth plan. So you've seen where we're going, and when you think about that, we are literally becoming a very important part of New York City's healthcare continuum. So our growth and evolution is significant. And one of the most important ways that we are growing Ronald McDonald House is through the undertaking of a major digital transformation. Our growth and focus on health equity really requires us to have new approaches, new partners, tell our story in a different way, and really be supported by new metrics. And so we're undergoing a digital transformation that really calls for us to bring ourselves into the 21st century. And I think you can relate to that because you're an online only club, right? And I'm sure you can appreciate a digital transformation as you've focused the work you're doing serving Jamaica's Lister Mayor Gilby's School for the Deaf by prioritizing upgrading that school's computers. We're establishing a health equity data center for children and families, and it really speaks to the need to be able to demonstrate the impact of Ronald McDonald House services by quantifying and qualifying that impact. The data center is the impetus for creating a data-driven culture at Ronald McDonald House, getting all of the systems to talk to each other and beginning to uh, collect and interpret the data we get from families through safe and electronic health records platform, safe and confidential ways, but ways that allow us to use the data to inform our programming. And lastly, I just want to share with you that in addition to the data center, we're creating a health equity practice center that brings together our interest in developing what is the most unique cadre of community health workers who will serve, who will specialize in the service of sick children and their families, training them, and also family-centered design with an equity lens, not only in our house, but in designing of spaces that are in hospitals and in the community as we prioritize these communities that need more services and these under-resourced institutions. And also research on family resilience, which is an important part of our work, where this particular population of children and families is under-researched, and we want to look at issues related to resilience with that population. So I describe that as work that this is work that we are building towards. And then last, I want to put that human face back on the story of Ronald McDonald House and the families we serve. And so if we could pause, I really want to share with you the story of Sonia. We could show that clip.
First off, thank you to everyone at Ronald McDonald House, New York, RBC, and everyone involved with the New York Rangers for this honor. The last few years have been tough, and moments like this help us keep marching forward every day. And I should introduce to you the superstar of our family, my daughter Sonia.
Hi, my name is Sonia. I am 10 years old and I live in Philadelphia. I am currently a proud survivor of neuroblastoma, a form of cancer that usually affects kids. My journey started on a hot summer day in August 2021 when I was swimming in my pool. My parents noticed something the size of a tennis ball growing inside my stomach. For this crowd, I guess I should say the size of a hockey puck. But anyways, I was immediately admitted to the hospital in Philadelphia and diagnosed with neuroblastoma. I underwent heavy treatment for a year and a half when I was told I was cancer free. But that's not the end of the story. Only months later, in May 2023, it came back. That's when my mom, who was pregnant with my baby sister at the time, found a hospital in New York City to continue helping me. That is who introduced us to Ronald McDonald House in New York.
We came to New York City in July of 2023, and Sonia was admitted to Memorial Sloan Kettering on the Upper East Side of Manhattan. We moved into the Ronald McDonald House a few blocks away. We stayed in New York City for 6 months. A lot happened in those 6 months, and we would not have been able to do it all without the support of Ronald McDonald House New York. They cared for us through Sonia's treatment and helped me with all my mommy needs. I had just given birth to Sonia's little sister, Gabriella, only a few days before we came to New York City. Being a new mom again is overwhelming. Too many nights you go to change a diaper at midnight and realize there's no more diapers and no way to get more. But at Ronald McDonald House, it's okay. The house provides diapers, bottles, formula, everything needed for the baby. The staff provided me with things I forgot I even needed. Things I hadn't thought were available at any time of the day. They took care of everything so that we could focus on Sonia and getting healthy. Then there's the food. Sonia is a picky eater. when she was still in the hospital recovering, she craved food that we ate at home, and she wouldn't touch the hospital food. So me and my husband would take turns using the kitchen at the Ronald McDonald house while Gabriella napped to fix meals for Sonia, more of what we cooked at home. Being able to prepare those meals for her was very important, otherwise I don't know how we would have gotten her to start eating again. Once Sonia was out of the hospital, she was always on the second floor playroom, playing video games or doing crafts. Nadia and Tuesday could keep her busy from sunup to sundown. Even if the playroom was closed for any reason, they would give her Legos or some sort of activities to do back in her room. I could always find her in the playroom or the living room with her new friends she made. Right?
The best thing about the Ronald McDonald house was that they treated me with love and care, and I made new friends. I have a lot of friends that are staff and a lot of friends that stay in the Ronald McDonald house like me. I have new friends all over the world, like Dominican Republic, Cayman Islands, and Arizona. Even when I go home, I FaceTime them to chat.
Since October of 2023, we've been back and forth between our home and Ronald McDonald house. We actually checked into the house yesterday for a week while Sonia gets follow-up tests done with her doctors. The Ronald McDonald house makes it easy to be away from home and even enjoyable. Thank you for making it possible for my daughter to get the treatment she needs and be able to have her family by her side. And for the opportunity you've given kids another chance at life. Without the Ronald McDonald House, New York, it wouldn't be manageable for my daughter to get the treatment that she needed to live a happy, healthy life as a kid again.
Today I'm cancer free. If there were no Ronald McDonald House, I might never have been able to come get the treatment I needed in New York City that made me all better. Thank you, Ronald McDonald House, New York, for helping me get better. And one more thing. Now let's go ice skating!
Thank you. You could play the last slide. Thank you. So really special little girl, Sonia.
McDonald House, New York,
Oh.
RBC, and everyone involved.
I think you can stop playing the video now. Thank you. Okay. Yep. So the last slide, I believe, of the PowerPoint. Anyway, I do want to just mention that, you know, Sonia, imagine this 10-year-old little girl is traveling with her mother and her father, her little sister who's 9 months old, and her mother is pregnant. So intergenerational impact of her cancer on this family. I know you all can relate to that because you, like the work we do with our families, the work your club is embarking on in Jamaica is going to ripple through geographies and generations. And so I want to leave you with a quote. It's a quote by Leanna Wen. Public health is a powerful tool to level the playing field, to bend the arc of our country away from distrust and disparities and back towards equity and justice. And at Ronald McDonald House, we've always served a multicultural, multilingual population. A significant portion of the New York City population we now serve is Afro-Caribbean or Caribbean. And as always, and like you, we're now exploring new partnerships through community health centers, churches, community-based organizations. We're an international organization that's diving deep into the local context in order to meet people where they are and to learn what work needs to be done. In working with the Lister Mayer Gilby School for the Deaf, the only certified school for the deaf in Jamaica, you have the opportunity to support programming that serves people directly, but also provides a model of service that addresses deeper, more entrenched issues of justice. Because of our children's illnesses, the families we serve live almost clandestinely, unseen and unheard in the general population. The long view we take is based on addressing the social determinants of health, elevates an underserved and even stigmatized group to the position they should occupy in the general population and the economy. And your work similarly serves isolated and underserved cultures. So we're both working for health equity. And as we at Ronald McDonald House, New York, move towards this more distributed model in a variety of settings, we're giving our guests memories that last a lifetime with the people they love. And you all are creating lasting memories for individuals, families, communities, and even a nation. It's challenging and satisfying work, and I thank you for the opportunity to share, and I wish you all the best in your own work. Thank you.
Thank you, Dr. Browne, for what I'm going to call an inspirational presentation. I have volunteered at our local Ronald McDonald House, but I had no idea of the breadth and depth of the services that Ronald McDonald Houses provide. I suspect that your center is somewhat unique or on the leading edge, but nonetheless inspirational. Thank you.
Thank you.
Are there any questions for Dr. Browne?
No,
Go ahead, Marie.
Go ahead.
I just have a question about your staff, actually. I know that people that are drawn to critical care have a special calling, but it must be very difficult for your staff to be surrounded by families and children that are in serious health issues. How do you support your staff to be able to give back?
It's a great question, and we're obsessed with it because our staff really have a hard time. It is very, very challenging to support these families, and there's loss. We've lost 14 children this year. It's not even June, right? As I said, the majority of the families go home with a great outcome, but there's still loss. So we do that in a variety of ways, whether it's social events we do for our staff. We invest in the training of our staff, in terms of how to deal with trauma. We have a wellness center, and we're trying to actually make that wellness center available for staff, but it's heavily utilized by our families. But yeah, and looking at we evaluate the engagement statistics of our staff every year, which fortunately are really, really good. It's a unique group of people who work at Ronald McDonald House. So I will say that there is a commitment to the mission that is really unique. And I think respite, right? It's important for our staff to have some respite. We did institute remote working, and continued it post-COVID. It is important that our staff who can work remotely have the opportunity to do that, but we also recognize that there are many staff who cannot. And so for them, we try to go, give some extra benefits to them so that they can take the respite they need as well. They are front facing on call all the time. But thank you for your question.
Peter, do you have a question?
Yes. I was just going to endorse what you said, David. I didn't realize that there was this breadth and depth to what the house represents. A quick question. I mean, I know your hands are tied with all that you do, internally, but
Yes, I'm actually going to ask, can we take down the PowerPoint so I can see who's talking? Your faces will come back on the screen, maybe.
Okay. All right. So are you seeing me now?
No, well, maybe if I
roll
over.
Okay. So the
Yes.
the question pretty much was, it sounds like your hands and your staff are tied with what you do internally, your internal programs, right? But do you get involved in any kind of community outreach program?
So yes, because we are trying to create a seamless circle of support. And so we don't believe we have to provide everything, and we can't. So our partnerships with other community-based organizations are around those other community-based supports that our families may need that we don't necessarily provide. And the practice center I described really would create the mechanism for working with academia, with other community-based organizations, other agencies that would allow us to advance our work, because there's something that there's something in it for all the partners, right? So yes, community-based initiatives interest us. I thought your question was going to be about policy. We have not been involved in policy. And when you think about this population of children and families, there are many policy issues for which our work can inform. And so definitely wanting to help the organization really begin to sit at some policy tables that will influence the potential health outcomes for these children and families.
Okay, great, thanks. David, I think you're still sharing your screen.
I'm still sharing. Oh,
Yeah.
I'm sorry.
Yes, thank you for
better?
that. Yes, much better.
There you go.
Yes, yeah, there we go. Yeah, thanks.
You're welcome.
Well, once again, Dr. Browne, thank you very much indeed. I thoroughly enjoyed the presentation, and I've been watching the audience. I can see the audience while the presentation is going. I've been watching them. You had people listening to your every word, and I really mean that. I'm not just being nice. Thank you very much indeed for your
Thank
presentation.
you. It was a pleasure to be with you. Take care, everyone.
Thanks a
Thank
lot.
you.
Thank
You're
you,
welcome.
Ruth.
You're welcome.